we have seen an increase in CT volumes. Specifically, last I looked back in the spring of 2024, of 30% year over year. I think over the summer, we exploded well beyond that. I've actually not looked at the numbers. We had a hospital closure nearby, and we have a health system that's been teetering on bankruptcy. A lot of our patients are not stable, so we need to scan them quickly. The scanner allows us to scan the patients quickly and get them back to where they need to be. But also, if we're expecting patients to hold their breath, the features of the scanner like hyperdrive, which allow us to get the patient through the gantry much quicker, allow us to get high quality images, and even in patients who are short of breath, or even if they're having a tough time staying still. Patients who are larger are scanned at reasonable radiation doses with adequate image quality, something we now take for granted, something we weren't able to do before. And we would always used to dictate about CT exam is limited by patient body habitus. If anybody who's looking to replace their CT scanner asks my opinion, I would definitely tell them that they should consider investing in a dual energy scanner and a high quality one like the Apex. In the future, it's going to become much more standard of care to see these scanners. We have repeat customers, both from provider practices and from patients. And I think patients and physicians are very happy with the service we provide.